Okay, Bismillahirrahmanirrahim. Now we are talking about the skull. That it derives from the Latin word cranium. There are 22 separate bones joined together by sutures. In the bones that include 8 cranial bones and 14 facial bones are present. Cranium, neurocranium encloses the brain. That includes cerebrum, cerebellum, and the brainstem, which we are going to discuss it in the later on in the in other videos. Okay, 8 bones are present in the cranium, or which forms the cranial cavity. Frontal bone, ethmoidal bone, parietal, temporal, occipital, and sphenoid. Okay, frontal bone is 1, ethmoidal is also 1, parietal bone 2 pair bones are present, temporal bone pair bones are present. Now I am going to show it to you in this form. This is the frontal bone. This is the ethmoidal bone. Okay, in this part you are going to see the ethmoidal bone, and this is the parietal bone. These two are the parietal bones. Okay, now these are the temporal bones. These two here you can. Okay, these here lies the temporal bone, here and here, right side, left side. These two are the parietal bones. Okay, and here lies the occipital bone. Okay, and here lies the sphenoid bone. Okay, now there is one point. There is sphenoid. Okay, now I'm talking about. Now we are going to tell. I'm going to tell you the pterion. In there is a clinical importance of pterion. There is an H-shaped suture here you can see, which is formed by 4 bones: frontal bone, temporal bone, parietal bone, and sphenoidal bone. Okay, here there is H-shaped. This one is H-shaped, and here lies the middle meningeal artery. There is a clinical importance of this suture, that the question is usually asked on the lateral blow. There is a lateral blow of the skull on the temporal bone, and which artery is most likely to get damage, or which suture or which part is most likely to get damage or gets injured, that is pterion. Or the question can be asked to you, pterion is formed by which bones. Okay, these 3 questions can come in your exams. Okay, now I'm going to tell you there are a few questions also. Which bone separates the nasal cavity from the brain? There is ethmoidal bone, which articulates with the frontal and the sphenoid bone. Okay, now I'm going to tell you the sutures. Okay, this one is the, here you can see, this is the coronal suture. This is the frontal bone. Here is the coronal suture, and this is the sagittal suture. Okay, this is the sagittal suture, and here is the lambdoid suture, which looks like a lambda. So that's why it is known as lambdoid suture. Now here are few points. The point that is formed by the coronal suture and the sagittal suture is known as bregma, and the point that is formed by the lambdoid suture and the sagittal suture is known as lambda. Okay, and here also lies the anterior fontanelle and posterior fontanelle. Okay, which I am going to tell you that they closes, and complete closure takes place at different period of time, which we are going to discuss it later on. But there is some clinical importance of the fontanelle also, that it helps in the labor. Okay, now comes to the 14 bones from the viscerocranium, that is mandible, nasal, maxilla, zygomatic, palatine, vomer, lacrimal bone, inferior nasal concha. Okay, now there are joints also. Here you can see the joints: synarthrosis, that allows no movement; diarthrosis, that allow free activities, and only free joint is mobile joint is temporomandibular joint, that is going to articulate over here. Okay, and forms the mandible or the coronoid condylar. This is the condylar fossa, and condylar part of the mandible is going to articulate over here, forming the temporomandibular joint that allows the free movement of the mandible or the mouth. Okay. Now the few points I have missed over here, that I am going to tell you, that there are 2 Norma Verticalis. Okay, first I am going to tell you here. Norma Verticalis, bones of the skull are connected with fibrous junctions. They are called sutures. There are total 33 sutures in the human skull. there is a biparietal diameter that is 9.5 centimeter. Here we can, this is the biparietal diameter. You can say that from the two parietal eminence, this is known as the biparietal diameter. This is going to, we are going to measure it from this parietal eminence and this parietal eminence. The distance is going to be measured from the here. Usually it is 9.5 centimeter. Frontal bone is a fused bone, and it is not frontal bone is a fused bone. There are, initially for there are two separate frontal bones, but later on they are going to get fused. But if it does not get fused, so it is, there is a suture known as metopic suture that is going to divide the two frontal bones, which is present in the median plane and separates the two halves of the frontal bone. Okay, now here you can see there is known as metopic suture that lies in the median plane, and there is anterior fontanelle that closes at 12 to 18 weeks, and the most closure takes place by 18 to 14 months. Okay, this is 12 to 18 months and nearly 2 to 2 years of age. And posterior fontanelle closes at 2 to 3 months, around the 6 to 8 weeks after the birth. And this is the reference has been taken from KLM 9th edition. There is the highest point of the skull that is known as vertex, and there are two parietal foramen are present. Here you can see the two, this is the frontal bone and this is the parietal bone. Here you can see in this skull the parietal eminence. The parietal foramens are not prominent over here. These two will be the, there lies the parietal foramen, and the point between the parietal foramen and the sagittal suture is known as oblivion between the two parietal foramen. Okay. Okay, there is also one more importance of the fontanelle is that in the adults we can check the hydration from the skin. If we do the skin pinch test, but in the children we check the hydration level by the fontanelles. If the fontanelle is depressed, it means that the that child is dehydrated. Okay, so we make sure that we fulfill its dehydration part. Okay, fulfill the hydration of that child so that it does not suffer. Also, there is overlapping, it allows the overlapping of the bones, so it helps in the labor during the birth of a child. Also, we can check if there is a CSF is increased, so we can identify or we can get the diagnosis from it that the child is having hydrocephalus. Okay, this is another importance of that child, and due to these fontanelles it also minimizes the chances of fractures, so when the bones overlap. So these are the few importance of the fontanelles that that can be asked from you, and that is good for your knowledge. Thank you.